Hello, welcome to another video. Like in the previous video, I will select an article for people who like to read about psychology, and this time I select not this one. Depression is in. I select this one. Sounds very attractive. Let's open it. And waiting website to be loaded, and the title is so depression is an inflammatory disease, but where does the inflammation come from? So we can read all the article, which is good. It is the article published in BMC Medicine Journal in 2013, and I know this author is quite popular. He's from Thailand, I guess. So it says Thailand, and also connected to this university from Australia. I don't know about it. Okay, let's read the article and try to understand where does the inflammation come from, because if we understand where the inflammation come from, then we can see how to target it and how to practically suggest someone how to improve it. We now know that depression is associated with a chronic low-grade inflammatory response and activation of cell-mediated immunity, as well as activation of the compensatory anti-inflammatory reflex system. It is similarly accompanied by increased oxidative and neutroxidative stress, which contribute to neuroprogression in the disorder. The obvious question this poses is, what is the source of this chronic low-grade inflammation? Okay, let's scanning the file and trying to understand why. So as you know, inflammation plays a role in many psychiatric diseases, including bipolar disorder, schizophrenia, autism, and post-traumatic stress disorder. And so if there is any table, then we can focus on the original contribution of the study. I don't think there is any, or if there is any. So obesity is included. I'm curious why they included it. With the prevalence of obesity increasing to epidemic proportions, efforts in understanding and risk factors and outcomes are continuing. So why they mention it? Further investigations. Obesity is an inflammatory state. That's interesting. That's why they mention it. Inflammatory states have been found in abundance in fat cells involved in fat metabolism and have been observed to be positively associated with all indices of obesity, particularly abdominal obesity. So that is interesting. Moreover, we and others have previously shown inflammation in particular, and they find that it may predict major depressive disorder. That's interesting. But there are some studies even claim that obesity is good for some cognitive skills due to its effect on hormones or other mechanisms. I'm not certainly sure right now, but indeed there are studies claim that obesity is not that bad, or overweight is not that bad, except the obvious deleterious health effects. And smoking is obviously about inflammation, and atopic disorders, allergen exposure leading to the development of allergic symptoms. Oh, that is interesting. So it's also one of the dental cares, and it's interesting to know that disease of oral cavity, where connective gum tissue gradually becomes detached from the alveolar bone and often leads to tooth loss. And so research which focuses on correlates of oral health and depression. But that is interesting because there's a possibility that people who are depressed do not care their oral health, or maybe their oral health is not good and they're depressed. Who knows? Like the exact relationship. Sleep is interesting. They include sleep, vitamins, and that's quite interesting review study. And let's read the conclusion part if there is any. Psychiatry largely lacks an integrated model for conceptualizing modifiable risk factors for depression. It has therefore lacked conceptually and pragmatically coherent primary prevention strategies prioritizing the treatment of established disorders. Yet the rationale targets an imperative to focus on prevention of depression at population level is clear. So by doing this study, they offer useful perspective for people who want to take preventive measures to reduce the depression, because it's not only in certain part, it is not only common in some people, it's actually everyone suffer in some period of their lives. Everyone suffer from it. So that's why I think it's important to read this article. And thanks for watching this video, and I hope you enjoy it, and you will comment it, or you can also visit my website to share more articles, and I would like to read them. Have a good day. Bye bye.